Through this video, you will discover tips to overcome premature release and make the pleasure last with your partner. Is it possible to treat premature release with a natural solution? Premature release is one of the most common male disorders, which can affect 39% of the male population at some point in their lives. There are, of course, exercises and effective treatments to learn how to control arousal and release more slowly. Mr. X reminds the importance of medical diagnosis. Premature release is a benign disorder that can be treated very well. Consult a therapist if you want a diagnosis, practical advice, and possible treatment. Precocious natural solution. Definition of premature release. It is defined as persistent or recurrent with minimal stimulation, and this before, during, or shortly after mating. And above all, before the person wants it. Premature release therefore occurs when one comes too soon during intercourse or pleasure-giving activity. There is no specific time period that defines coming as early. It can occur as early as 30 seconds or as late as 4 minutes. Premature release can occur for a variety of reasons, ranging from psychological causes to physical triggers. Everyone has different expectations of intimacy. Premature release is therefore not always an easy disorder to define using bed performance statistics. On average, it takes about 5.5 minutes for a man to come during lovemaking, but this can vary significantly between different individuals and couples. How do you know if you are a premature comer? But then, are you a premature man? Well, according to a study, at least 20% of men are affected by premature release. So how do you diagnose it? Premature or too fast? Symptoms are frequent, almost immediate release within 30 seconds to 1 minute following mating. Difficulty preventing coming during intercourse or any other pleasure-giving activity. And a feeling of disappointment, anxiety, or dissatisfaction with their bed performance, and therefore an avoidance of their potential pleasure-giving activity. Most of the time, doctors will diagnose a patient with premature release if they have one or more of the above symptoms. Researchers are not yet sure what causes this disorder. Several factors may contribute: prostate problems, thyroid problems, drug use, heightened physical sensitivity in some men. For a diagnosis and solutions to premature release, consult a therapist. Any natural solution? At present, it is possible to treat premature release with a natural solution. You can use relaxation and communication techniques. You should not hesitate to talk to your partner or even communicate during lovemaking. The TIME program, designed by a team of therapists, brings interesting results in learning to better control your release in a sustainable way. It is designed to help you and your partner better control the stimulation that causes you to expel semen too quickly. In some cases, doctors also prescribe medication to delay release. They may also recommend creams and gels designed to reduce manhood sensitivity. Being premature in bed can be a stressful and difficult experience, especially if it happens unexpectedly. However, it is a very common disorder that can be treated with the right support. You can consult a therapist to get help, to better control your arousal, and to delay release. In addition to physical and mental exercises, there are also treatments that can help you last longer in bed. Precocious natural solution, techniques to delay release. To treat premature release as a natural solution, you can try to increase the duration of your hardness. Here are 3 techniques you can try. Number 1, the stop-start strategy, also known as stop and go. You can practice this with your partner or alone. When you feel yourself approaching climax and intense release, stop the stimulation and take a break. Then repeat until you feel more confident in your ability to control your release. This is a great first option for premature release. It also makes it easier to spot the point of no return. Number 2, the squeeze technique during intercourse. As you approach release, squeeze the area between the body and the tip of manhood to prevent coming. It is recommended to squeeze the manhood for about 30 seconds to stop premature release. By using this technique, you can delay climax several times, which allows you to last longer in bed. Edging is also a way to delay climax voluntarily. Number 3. Self-stimulation. Sometimes the easiest way to last longer in bed is simply to pleasure yourself shortly before making love. The idea behind this approach is that during the refractory period, a recovery phase that occurs after climax, most men will not be able to reach climax. The end result is a longer average time to reach climax and, for their partners, greater pleasure satisfaction. Finally, you can also wear delaying condoms to last longer in bed. They are designed with an extra thickness at the tip of the manhood to reduce its stimulation. Discover another natural method in our video, Benefits of Aloe Vera to Last Longer. Precocious natural solution, is there a medicine to delay release? Most of the time, drugs are not necessary for premature release problems. In fact, men suffering from rapid release can increase their time to reach climax by using psychobehavioral therapy techniques. These reduce levels of anxiety and nervousness about intimacy, a factor that can help improve overall bed performance. However, the drugs allow for rapid results and thus a quick return to self-confidence. They can be useful while waiting for other solutions to get results. There are 2 types of effective treatments for premature release. There is a first category of treatments that are applied directly to the private area, and these treatments aim to slightly anesthetize your manhood in order to delay release. A second category of treatment is made up of drugs in pill form that hold serotonin in the brain. Oral treatments for premature release. One solution to premature release is to use selective serotonin reuptake inhibitors. Until a few years ago, there were no specific drugs to treat premature release. SSRIs, used to treat depression and anxiety disorders, were found to be effective. Since then, Premature and its active ingredient, dapotextine, have been developed to meet this need. The tablet can be taken 1 hour before intercourse. It can also be taken daily to maintain spontaneity in everyday life. It is a prescription drug available in pharmacies. You should therefore consult a therapist before taking it. Premature costs about $30 per box of 3 tablets. Its price is set freely by pharmacists, which explains the slight difference from one pharmacy to another. Topical treatments. The second possible treatment is the use of topical treatments, delaying gels, creams, etc., such as Forticin. Forticin is a drug whose active ingredient is lidocaine. Lidocaine is a local anesthetic. It can be applied as a spray, cream, or injection. When applied to your manhood as a spray or cream, lidocaine reduces sensitivity. This is especially true during foreplay and intercourse. This means that you are more likely to come later. Although lidocaine spray affects your sensitivity during intercourse, it does not make your manhood too numb, so it does not reduce your pleasure. How do I use lidocaine spray? The use of lidocaine spray for premature release is simple. It should be applied to manhood and its tip 20 to 30 minutes before intercourse. Then massage in circles until it is completely absorbed. Lidocaine spray is sold in a measuring bottle. This allows you to apply 1 or more doses to your manhood. However, it is best to start with a small dose before intercourse. First, if you do not notice a major bed performance improvement, you can increase the dose, but you must follow the instructions provided. It is best to wipe your manhood with a damp towel. You can also take a shower before intercourse. This will ensure that there is no more spray on your skin. Secondly, don't forget to wipe your hands, because lidocaine can make your skin numb if it stays there too long. It takes 20 to 30 minutes for the lidocaine spray to start working. This means that you will have to wait before you start foreplay or intimate activity. Finally, there are gels, creams, sprays, and other treatments. These are designed to reduce sensitivity and stop premature release. Most of these gels and sprays on the market use local anesthetics such as lidocaine and/or prilocaine. Even with these methods, it is possible that your precocity is due to an erectile dysfunction. If you want to be sure, fill in the questionnaire in the description and you will have the answer in less than 5 minutes. Are premature release medications effective? Premature release can be treated well, as we have already said. Most of the time, specialists decide to prescribe 2 drugs, Forticin and Prilogy. The first results appear very quickly and the duration of intercourse increases. However, Prilogy has many side effects, which is its major drawback. This is why a therapy allows all mental and physical techniques to be worked on at the same time. In addition, daily support is provided for lasting results. Why is consulting a therapist recommended? It is strongly recommended to consult a therapist online to discuss intimacy problems. The therapist will be able to offer you appropriate treatment to help you regain a fulfilling love life and avoid further psychological problems. Indeed, suffering from precocity often has negative psychological consequences: lower self-esteem, low libido, anxiety, shame, etc. In addition to this, he is the ideal person to talk about intimacy in the broadest sense of the term and to discuss the relationship between the couple in particular. He or she can also refer you to psychological and behavioral therapies if necessary. Are there natural solutions for premature release? It combines exercises and treatment if necessary. The aim is to achieve conclusive results as quickly as possible while taking care of your health. Some people will offer you hypnosis sessions for premature release. However, we cannot guarantee the effectiveness of these solutions. Natural solutions for premature release. The reason why problems like this one are difficult to treat is that they are driven by the unconscious, and any effort you make to cure it tend to be conscious. This is where hypnosis comes in. Hypnosis for premature release. Hypnosis is the art of communicating with the unconscious, so we can use it to uncover the patterns that make you come too soon. And as a result, it generally relieves the pressure. So, by relaxing and listening to your session repeatedly, you can uncover the old performance unconscious pattern, be relaxed when you reach climax, feel confident that you can have relaxed intercourse, start to look forward to making love again without fearing the quality of performance. Therapy with a therapist. It is a comprehensive summary of several methods to battle premature release that are used nowadays. Reappropriation of the body and its sensations, comprehensive intimacy therapy, and physical and mental exercises. The experience of therapists shows that combining all these methods gives the best results. It has been developed by several therapists, and the feedback from patients is very conclusive. Finally, you can consult a therapist online easily and quickly.